From outdoor workers sweating through double shifts to pregnant slum dwellers, one power cut away from a health crisis. Heat waves in India have long taken a heavy toll on the most vulnerable. On August 4th, the centre formally recognized heat waves as a notified natural calamity, unlocking dedicated funds for states to protect those most at risk. Officials say the move could reshape both the funding available for heatwave response and how measures are implemented on the ground.
There would be a broader recognition of various climatic factors that contribute to the rise in temperature and the corresponding measures at the local level to reduce the impact of the rise in temperature. It wants to improve the provision of various kinds of support that improve thermal comfort in public places. We have a certain amount of resources that could be invested in these interventions.
Until now, states could tap only a limited share of disaster funds for heat waves. Now, that cap has been lifted. But funding is only part of the story. Experts say the real cost of extreme heat has long gone unmeasured, affecting India's economy as heavily as its people.
A lot of the workforce is going to continue to work outdoors in the open, whether it's in our farmlands or in our cities building infrastructure and buildings. Heat stress, therefore, is not just a climatic event, it's an economic calamity because it impacts the productivity of our workforce. We also have to take care of the informal labor force, which is a very large share of our labor force, because if they don't come within the radar of our response measures, then they too remain invisible, even though they are so critical to the Indian economy.
With outdoor and informal workers bearing the brunt, doctors say the health toll of extreme heat is deeply tied to poverty, and tackling one means addressing the other.
There is something called as poverty and health cycle, poor health cycle, where for accessing health, for accessing better health, people spend most of the money from out of pocket, So in this way, if we provide assistance in the form of financial assistance or some rehabilitation measure through the state sponsorship schemes, then that definitely not only elevate the economic status of the affected individual, as well as that will prevent the financial deprivation. We will move towards a climate resilient health system so that we can treat the heat impact of health very, very efficiently.
On the ground, that means moving beyond simply adding more heat action plans to ensuring they are properly funded, locally driven, and effectively implemented. Experts point to global precedent, drawing parallels with how disaster recognition helped transform India's response to COVID-19.
What happened during COVID is the notification that gave it an identity as a disaster, and that's how the entire system came into the place and started working in a coordination. That's what we can take, for example, heat also. While the heat action plans or heat wave were not notified as a disaster at a national level, there were certain states, for example, around 11-12 states in India that had notified heat wave as a local disaster. But the gap was the coherence between the policies, guidelines and framework at a national and sub-national level. Now with this notification, there is no confusion that heat wave is a notified disaster across the country. There has to be frameworks which NRDC has been supporting at a national and sub-national agency, which can help in implementing the heat action plan.
With summers growing longer and hotter, and millions of outdoor workers, slum dwellers and vulnerable families at risk, this notification marks a shift from treating heat waves as an afterthought to confronting them as the disaster they've always been.